Uh, Thank you, Dr. Gaurav sir, for giving me this opportunity. It's slightly intimidating speaking after Mahipal sir. I mean, he is a force to reckon with. And well, I've been asked to speak on your mother has a brown cataract. What will you prefer for her surgery? One is, if an ophthalmologist mother has a brown cataract, well, he may be a very good ophthalmologist, but he's certainly not a very good son to allow the mother to develop such a brown or a black cataract before thinking of operating her. I'm speaking that SICS is not better than phaco, even FLACS in certain conditions. Phaco is a fantastic surgery. Most of the work that I do in private practice is phaco. But then for very hard cataracts, very old patients with poor endothelial cell counts, post-keratoplasty, uveitic cataracts, subluxations, small incision cataract surgery, the manual SICS definitely has its own advantages. I'll not go into the videos of it because I'm sure all the surgeons in this room, they are aware of SICS and they do that surgery. The only differentiating factor, as Mahipal sir said, is SICS is a larger incision. And because it is a larger incision, it causes more astigmatism. And of course, it's slightly less predictable because with a larger incision, things can go differently. But then as I look at this ad of Surf Excel, kuch daag achhe hote hain, you know, this astigmatism is what gives a good unaided near vision. The fantastic FLACS surgery that we saw with a very clear cornea, that patient may be 6'6" for distance, but that patient will not even be N12 or N18 for near, and that patient is not going to be a very happy patient because of that, unless we have put in a multifocal implant. We have done a meta-analysis comparing phaco versus small incision surgery, looking at all the literature, about 110 publications, 13 head-to-head randomized controlled trials with both of them, and we look at a meta-analysis, which is perhaps the gold standard. There is no difference between the two techniques at the best corrected or unaided cutoffs of 618, that's the normal vision, or 660. Even BCVA at 6.9, there is no difference. There is a difference at unaided 6.9, which is the driving license standard, where phaco definitely gives better unaided visual acuity because it's through a 2.2 or a 2.6 millimeter incision compared to at least a 5.5 to anywhere up to 7 mm for a SICS. And of course, there was no difference either for endothelial cell loss or complications. In fact, SICS was safer for beginner surgeons, and there are trials from the Arvind Eye Hospital where it has found to be safer when we are doing a brown or black cataract. Astigmatism is definitely less in phacoemulsification, without doubt, but that astigmatism is a differentiator because it gives better unaided near vision. So if we have a 80 or 85-year-old or a 90-year-old gentleman whose corneal endothelial cell counts are not that great, and we insist on doing phaco because everybody may not have a FLACS machine. After that, all these patients definitely want better near vision because most of their activities are for near. They want to read, they want to work on their tabs, on their laptops, on their mobiles increasingly. And for that, either we'll have to give them a spectacle addition or we would have to put in a multifocal implant. We know that in very old patients, even multifocal implants don't work that well because the loss of contrast sensitivity is a differentiator. So each technique has its own merits, but if it's a very, very old patient and a patient with a very brown or a very hard cataract, then manual small incision cataract surgery is definitely an option that is safe, an option that is easy, and an option that is also fairly predictable. Thank you.
Thanks, Parikshit.